Hi, I'm here today with Dr. Paul. Let's talk about facelift. Thank you, Dr. Paul, for coming.
Great to be here, Gurus.
What is the facelift?
Well, the aim of the facelift is to make the patient look younger and more refreshed, but in a natural way. That normally involves lifting the facial tissues to produce an increase in cheek volume, cheek projection, but make the lower face look slimmer with a more defined jawline and neck angle.
Who is suitable?
So the range of people are suited to facelifting. Relatively younger people with early signs of ageing in their 40s, mid to late 40s, may be considered for what's called a short scar facelift, where we make an incision just on the front of the ear and into the hairline and make a more minor adjustment to the face to make them look younger. As patients get older, more towards their 50s and above, they'll tend to get more laxity in the face but also the neck as well. And they'll tend to require a full face and neck lift with incisions not only on the front of the ear and the hairline above, but into the behind the ear and into the hairline behind.
How is the surgery performed?
Yeah, the surgery is performed under a general anaesthetic. Usually takes between 2 and 4 hours, and the patient spends a night in hospital. The incisions are made, on the front or the front and the back of the ear and the adjacent hairline. The skin is raised, and the deeper tissues of the face are lifted to create the more younger shape. The small amount of skin excess is removed and the wound's closed. The patient's then put into a dressing overnight with 2 small drains. The following morning the drains and dressing are removed before the patient goes home.
What is the recovery period?
So depending on the extent of the surgery, the patient needs between 2 and 3 weeks off from work and their normal social activities. If the correction is just in the mid-face and the neck, 2 weeks is normally sufficient. They'll have some mild swelling and bruising in that period before it settles. Stitches are taken out at about 1 week with some further tapes put on for another 5 days. Usually by 2 to 3 weeks, most of the swelling is settled for them to return to their normal work and social activities. There will be some further settling over the following weeks, but this is less noticeable.
How long the result lasts?
So a good, well-planned facelift should last at least 10 to 12 years, possibly longer in some patients. But it depends on the patient's lifestyle, particularly whether they smoke, whether they have a lot of sun exposure, how hard their work is, how much sleep they have, but also some genetic elements.
Can the facelift be combined with another procedure on the face?
Yes, commonly we will combine it with surgery to the eyelids, what's called an upper or lower blepharoplasty, and quite often with a brow lift to give a comprehensive rejuvenation of the whole face and neck areas.
Dr. Paul, is better we start when we're young or when we're old?
Well, it's probably better to have small amounts of surgery more regularly than to leave it a longer length of time and have more extensive surgery at a much older age. That allows each surgery to have a smaller extent. The tissues are also of better tone, so hold the shape better. And also by having some regular treatment, some scar tissue is laid down into the face, which strengthens the tissue and holds the shape better for longer. It also means that you don't require a large amount of surgery at an older age when you're not quite so fit.
Thank you, Dr. Paul, and see you next time.
Thanks, Guru. It's great to be here.
Thank you, bye.
Geruse Beauty. A gente cuida de você.